I don't know if you've heard about it, but there is a process of ozone hyperthermia using a steam chamber. So, an ozone sauna is a fiberglass chamber that you sit inside of, and your head stays outside of the chamber so that it's not exposed to the ozone gas. The chamber itself is filled with steam as well as the ozone gas. Basically, what the steam does is it helps to open up your pores. The water in the steam activates the ozone gas so that as your pores are open, the ozone absorbs through the skin. It does actually work very nicely transdermally to get into the lymphatic system, since a lot of the lymph glands are very close to the surface of the skin, as well as helping with ligaments and tendons, joints, muscles. We would use it for pretty much anything musculoskeletal. It's a great detoxification therapy. It is also something that we would use with cancer patients, especially those who have lymphatic involvement, breast cancers, as well as skin cancers. Because ozone is an oxidizing therapy, it naturally will promote the increase of antioxidants present in healthy cells, and also significantly increase immune response. So this is, again, another video that I've made that doesn't have anything to do with our ozone products. It is purely for educational, informational purposes, so that you know that there are other options available, and that as far as the immune system is concerned, one thing that I haven't mentioned yet so far is that the overall increase in body temperature not only helps to liquefy the lymphatic fluids to help the lymph system to drain, but the increase in body temperature also simulates a fever, which the body normally creates in order to stimulate the immune system to fight infections. So you're artificially elevating the body temperature, but you're keeping the head cool, which keeping the brain cool is very important unless you're dealing with something that is a systemic bacterial infection that has the ability to penetrate into the brain, such as a spirochete infection or brain cancer. Neurological conditions, we typically would use the ozone sauna to help detoxify if there was, let's say, an excess heavy metal load or chemical pesticide or mold issue that was affecting the person neurologically. But it wouldn't be a direct way of introducing oxygen into the brain specifically. So keep that in mind. It's great for whole body, but it has its limits as far as neurological benefit is concerned, unless it's caused by a toxin, a microbe, or a heavy metal issue. So ozone saunas are found throughout the entire country. I encourage you, if you're interested in this therapy, to look on Google or DuckDuckGo, run a search for ozone therapy near me. Find an ozone practitioner who has been trained, is experienced, and will be able to help you with the treatments. An ozone sauna can be used at home. When we closed our clinic, of course, we already had an ozone sauna at home, but we did end up selling ours to a patient who was absolutely in love with them. In her case, it actually helped with the skin elasticity and dryness. Her skin just had she had a condition where her skin would be chronically dry and cracking. When she got the ozone saunas, the ozone, when it is introduced into the skin, generally will help to pull moisture toward the skin from inside the body, from internal tissues. So it's a nice way of constantly hydrating the skin, even though it seems a little backwards because you think that it would dry it out, but it does help to moisturize. Anyways, can't be done at home, except for ozone chambers can be quite expensive. They are not as commonly made or sold as a far infrared sauna would be. But if we were comparing the two between infrared sauna and ozone sauna, I don't own an infrared sauna. I never will. I am hands down 100% ozone sauna all the way. And it was the only thing that I would recommend to the patients that were coming into our clinic, or even those who would contact me from different countries seeking care. So it's a wonderful treatment. Each session lasts about 30 minutes. We never really brought it up too high in temperature. 102, 105 was sufficient in order to get the job done. No more than 2 treatments per week. Also, generally about 6 weeks of care, and then reevaluate, dropping it down to maybe once a week, once every 2 weeks, once a month, depending on what maintenance the person needed. If it was a more serious condition, of course, we would keep going longer than that 6 weeks. But for most individuals who are needing it for general health, we would just do it once a month for maintenance. What's really interesting is I've never seen this with an infrared sauna before, even though I have had experience with them. The ozone saunas, what was quite interesting was we would generally lay a towel down on the seat, and after the person would get out of the sauna, there would be discoloration on the towel from different toxins or metals that they would sweat out during the session. And I thought that that was quite neat. In one case, there was a woman with metastatic breast disease. She had 15 tumors bilaterally, both breasts. And during her saunas, when she would get out, we would find a blue, I'm not kidding, an actual blue, indigo blue staining on the towels, which we've never seen before. It almost looked like she had a blue ink pen that she had took into the chamber with her, and that it had opened up during the sauna. She didn't. She was completely undressed. We discussed this over several occasions after she would get out of the sauna. She was pretty freaked out in the beginning, but as her detoxification continued and her overall cancer load decreased, the amount of staining decreased as well. So never found out what it was. I didn't send it off to a lab and do all that cool stuff because I was young, didn't have a whole lot of money. We were building the practice. We were just excited about the results. She was excited. We have a lot of videos from patients from the years past, but they aren't easily uploadable because they weren't always in a digital form because technology has changed so quickly. We're trying to get some of those videos transferred over into a digital form so that we could upload them onto our YouTube channel and allow you to enjoy them and kind of see what the results were over time. We did have her using our ozone salve on her chest. I can't remember because this was back in 2008. Exactly what all we did, but I do remember the salve and I do remember the sauna. So give it a try. It's relaxing. If you're recovering as an athlete, it's something that ozone saunas will help you recover faster. That's why I have one, is because I love it, especially in the wintertime. Summertime, it's much harder to get in there and stay in there for the full 30. But the winter, I absolutely I can sit in there, I can chill, and I love to do them on a very regular basis. If you really want to get crazy and get even better results, you can get into an ozone sauna and then get into a hyperbaric chamber right afterward. Ozone has the ability of modifying the hemoglobin of our red blood cells, allowing them to hold up to 10 times more oxygen for a very short period. So we would do that with patients that came in. We would do an ozone sauna, then perhaps give them an IV, and then get them into the hyperbaric chamber in order to build from one treatment to another synergistically to increase the efficacy of all of them, providing our patients with better care. And so if you find a really good practitioner who thinks outside the box, very creative, very knowledgeable, they'll be able to put together protocols like that for you. Again, just search in your area, see who you can find. I do offer training, so if you have a doctor or practitioner in your area who's interested in ozone, I do it online. I also fly out, I set up the clinic for them, and pretty much full service. So website ozonecharged.com. There is an email that you can email me. You can comment on the videos and try to help as much as I possibly can. Hope you have a great day. Take care.